Joints are connections between bones. Synovial joints create movement. I'll show each type of joint movement and explain which bones are connected and how that movement can be used in a fight. Abduction. At the shoulder joint where the humerus connects with the scapula and clavicle, abduction happens when I raise my arm away from my body. This is used to throw a hug punch. Adduction. At the shoulder joint where the humerus meet the scapula and clavicle, adduction brings the arm back towards the body. Extension. At the elbow joint where the humerus connects to the ulna and radius, extension strains the arm. This is used for a strong jab. Flexion. At the elbow joint where the humerus connects with the ulna and radius, flexion bends the arm. This helps form a guard or pull an opponent. Dorsiflexion. At the ankle joint where the tibia, fibula, and talus meet, dorsiflexion lifts the toes towards the shin. This helps strike safely with the ball of the foot. Plantar flexion. At the ankle joint where the tibia, fibula, and talus connect, plantar flexion points the toes down. This is used when kicking. Medial rotation. At the hip joint where the femur connects to the pelvic girdle, medial rotation turns the leg inward. This adds powers to kick and punches by rotating the body. Lateral rotation. At the hip joint where the femur meets the pelvic girdle, lateral rotation turns the leg outward. This helps change stance or defend against a takedown. Supination. At the radioulnar joint where the radius and ulna meet, supination turns the palm upward. This helps with inside grips during grappling. Pronation. At the radioulnar joint where the radius and ulna connect, pronation turns the palm downward. This helps control the wrist. Inversion. At the intertarsal joints where the talus and calcaneus connect with the other tarsals, inversion turns the sole of the foot inward. This can help stabilize eversion. At the intertarsal joints where the talus and calcaneus connect with the tarsals, eversion turns the sole outward. This helps balance or pivot during movement. Protraction. At the scapulothoracic joint where the scapula moves along the rib cage, protraction pushes the shoulder blade forward. This gives a punch more reach. Retraction. At the scapulothoracic joint where the scapula slides along the thoracic cage, the retraction pulls the shoulder blade back. This helps pull your arm in fast after a punch. Elevation. At the shoulder girdle where the scapula and clavicle connects to the sternum, elevation lifts the shoulders. At the shoulder girdle where the scapula and clavicle meet the sternum, depression lowers the shoulders. This helps relax the stance and prepare for the next movement. These demonstrations show how specific joints and bones create functional movement using striking, blocking, and grappling.